everyone, welcome to Try Right. This is Pack 365, myself Srija. So today you're going to learn about continuation of factors influencing health status and contact with health services guidelines. That is code series from Z00 to Z99. So coming to screening. So what is screening? So screening means testing healthy looking people to find a disease early before symptoms appear. So the person does not feel sick. The aim is early detection and early treatment. For example, mammogram to detect the breast cancer and pap smear to detect the cervical cancer and blood sugar test to detect the diabetes. So early detection can save life and also reduce the complications. Screening versus diagnosis test. So what is a very important difference? So screening is done in apparently healthy people, whereas diagnosis test, it is done when symptoms are present. And what is the purpose of screening? To find the disease early. What is the purpose of diagnostic test? To confirm or rule out the disease. For example, mammogram in a healthy woman is an example of screening, and chest x-ray for cough is an example of diagnostic test. So if a patient has signs or symptoms, the test becomes diagnostic but not the screening. So what is the use of signs and symptoms? So when a patient has symptoms, the symptom explains the reason for the test. The symptom is coded but not the screening Z code. Example, patient with breast lump. So you have to screen by using mammogram because this is diagnostic but not the screening. So what is the use of screening Z codes? So when screening is the main reason for visit, so screening code can be first listed diagnosis. For example, visit only for mammography. So Z code for breast cancer screening is used first. And second one is when screening is done along with another visit. So screening code is used as an additional code in this case. For example, patient visits for hypertension. So during visit, colon cancer screening is done. So when screening code is not needed, if screening is part of an routine examination, the screening code is not needed. Example like pap smear during routine pelvic exam. There is no separate screening Z code is required. So if a disease is found during screening, the actual disease code is added as an additional diagnosis. For example, like screening test positive for cervical cancer. So you have to add the cervical cancer code along with the screening code. So what is the meaning of a screening Z code? So it indicates that the screening examination is planned or performed. It does not mean disease is present. So what does a screening Z code mean? A Z code shows that a screening exam is planned or done. It does not mean the patient has the disease. It only explains why the test was ordered. So to prove the test was actually done, a procedure code like CPT is also required. So what are the main categories of screening Z codes? Z11, that is screening for infectious and parasitic diseases. So this is used when screening for infections in people without symptoms. Examples like HIV screening, hepatitis B or C screening, and also tuberculosis screening. Coming to Z12, encounter for screening for malignant neoplasms. So this is used when screening for cancer in healthy individuals. Examples like mammogram for breast cancer, pap smear for cervical cancer, and colonoscopy for colon cancer. Next is Z13 screening code. Encounter for screening for other diseases and disorders. So this is used for screening of non-infectious, non-cancer conditions. So what are the examples? Diabetes screening, hypertension screening, and thyroid screening. So exception is Z13.9. So this is used when type of screening is not specified. So you have to avoid using it if a specific screening code is available. And next is Z36, encounter for antenatal screening for mother. So this is used during pregnancy when screening tests are done for the mother. Example like ultrasound screening, blood test during pregnancy, and genetic screening. So what is a very important decision rule here? So does the patient have a sign or symptom that prompted a test? If yes, you have to report the sign or symptom. Do not use a screening Z code. Example like patient with fatigue tested for anemia. So code fatigue but not screening. If no, report the screening Z code. If a condition is found, you have to add the disease code as an additional diagnosis. For example, routine diabetes screening. Result is diabetes detected. So you have to use screening Z code plus diabetes code. So what you have to remember is, if there are no symptoms, you have to assign screening Z code. If there are symptoms, you have to assign the symptom code. If a disease found, you have to add the disease code. So this is how you have to assign codes for screening. And next, coming to observation codes. So what does mean by observation? So observation means the patient is kept under watch because the doctor suspects a condition, but after evaluation, the condition is ruled out. There is no disease is finally diagnosed. So why are observation Z codes important? So there are three observation Z code categories. They are used only in very limited situations. So this is used only when a suspected condition is ruled out. So when observation Z codes are used, when patient is observed for a possible condition, when tests are done, when condition is ruled out and there are no symptoms or illness remain. Example is baby observed for possible infection. So here infection is ruled out. Patient observed after accident. So there is no injury found. So when observation Z codes are not used, so if injury or illness is present, if signs or symptoms are present, you have to not use the observation Z codes. So in such cases, what you have to assign? You have to use the diagnosis or symptom code. Also use the external cause code if needed. Here is an example. If a patient with chest pain diagnosed, so you have to observe for the heart attack. So you have to code the chest pain but not the observation. So what is the position of observation codes in coding? As a principal or first listed diagnosis, observation codes, they are mainly used as a first listed codes. So they are used when observation is the main reason for the admission. Coming to as a secondary diagnosis, this can be used as a secondary code if a patient is observed for a condition and the condition is ruled out and the observation is not related to the main diagnosis. So what are the special rules for newborns? So Z38, live born infants. So this is Z38 is used as a principal diagnosis. So Z38 code, it always describes about the place of birth and type of delivery. Next is Z05. So Z05 is the observation of newborn for a suspected condition. So this is used when a baby is observed and evaluated. The suspected disease is ruled out. So what is the sequencing rule over here? First you have to assign Z38 followed by Z05. There is a simple newborn example. Baby born in hospital and baby is suspected sepsis. So test done for sepsis and sepsis is ruled out. So how do you code Z38 for live born infant and assign Z05 for observation for suspected condition ruled out? So what is Z03.7? So when Z03.7 is used, so it is used when a maternal or fetal condition is suspected, when test or evaluation are done, when the condition is ruled out, when the mother or fetus is found to be normal. So these codes, they are used in very limited situations. So what is the use of additional code? So other diagnosis codes, they may be added only if they are unrelated to the suspected maternal or fetal condition. So do not add codes related to the suspected condition that was ruled out. So first listed or additional code. Codes from Z03.7 can be first listed diagnosis, can also be the additional or secondary diagnosis. So this depends upon the reason for the visit. So when are Z03.7 codes used? So these are used on the mother's medical record. When an abnormal test result suggests a problem, when a maternal or fetal condition is suspected, when further evaluation shows no problem. Example like abnormal ultrasound suggests fetal anomaly. So detailed scan shows fetus is normal. So in this case, you have to use Z03.7 code. And when Z03.7 codes should not be used. So when the condition is confirmed, you have to code actual confirmed condition but not Z03.7. If illnesses, signs or symptoms are present, You have to use diagnosis or symptom code but not Z03.7. If the visit is for antenatal screening, so use Z36 for screening but not Z03.7. So use of additional codes with Z03.7. So how to use the additional codes? So they are allowed only if unrelated. For example, patient evaluated for suspected fetal condition is ruled out, also as anemia. So you have to assign Z03.7 code plus anemia code. So you have to check the screening rules before using the observation codes. You have to check section IC21 for screening before assigning observation codes. So when fetal evaluation is inconclusive, so if a suspected fetal condition is tested but the results are not clear, so do not use the observation Z codes. So instead use the appropriate pregnancy complication codes from O35 category, O36, O40 and O41. O35 is for maternal care for known or suspected fetal abnormality, whereas O36 is for maternal care for other fetal problems, and O40 for polyhydramnios and O41 for other amniotic fluid disorders. So observation codes, these are used only when the condition is ruled out but not when it is uncertain. Observation Z code categories. Z03. So medical observation for suspected disease ruled out. So this is used when disease is suspected, patient is observed and tested and disease is ruled out. Example, patient observed for appendicitis. And Z04, encounter for examination and observation for other reasons. So this is used for observation but not related to the disease. Examples like legal examination, examination after the accident with no injury, and exception is Z04.9. So avoid using unspecified if a more specific code is available. So next is Z05 category, observation of newborn for suspected disease ruled out. So this is used for newborns only. So baby is observed and evaluated. So condition is ruled out. For example, newborn observed for infection, which is ruled out. So this is how the observation codes are used. And next is aftercare. So aftercare, what is aftercare? Aftercare means initial treatment is completed. So patient now needs a healing care, recovery care, follow-up care as well as long-term management of the effects. So what are the examples of aftercare? Dressing changes after the surgery, physiotherapy after the fracture healing, follow-up after the chemotherapy, wound care after the injury. So when to use aftercare Z codes? So when treatment is completed, when a patient is in recovery or healing phase. When not to use aftercare Z codes? So if a patient is still being treated for an active or acute disease, you have to use the current diagnosis code but not the aftercare code. So there are some exceptions to these rules. So normally aftercare Z codes are used only when the active treatment is finished. So cancer treatment is an exception. Z51.0, encounter for anti-neoplastic radiation therapy. So this is used when the visit is mainly for radiation therapy for cancer. So Z51.1, that is encounter for anti-neoplastic chemotherapy and immunotherapy. So this is used when a visit is mainly for chemotherapy or immunotherapy. And how to code this? Z51.0 or Z51.1 is listed first. So the cancer or the neoplasm diagnosis code is listed after. Example, patient comes for chemotherapy for breast cancer. So Z51.1 is assigned first, then breast cancer code is assigned. So if more than one cancer therapy is given, if a patient receives both radiation and chemotherapy, you have to assign Z51.0 plus Z51.1. So one will be first listed, the other will be secondary. And second guideline is aftercare codes, they are not used for the injuries. So do not use aftercare Z codes for injury follow-up. So what is the correct method for injuries? So you have to use the original injury code You have to add the seventh character D for subsequent encounter. So what is an example? Follow-up visit for healing fracture. And you have to use the fracture code with 7 character D, but not an aftercare Z code. So what will be the sequencing of the aftercare codes? When aftercare is the main reason for the visit, aftercare Z code is always the first listed. When aftercare is provided along with the another treatment. So how do you code? Aftercare Z code can be used as an additional code when it is provided along with the another treatment. So this is only when there is no diagnosis code explains the aftercare, and aftercare is not the main reason for the admission. So what is an example? Patient admitted for another condition. So during the same visit, colostomy closure is done and aftercare Z code used as an additional diagnosis. Aftercare codes, they should be used in conjunction. So you have to use aftercare codes with other codes. How do you assign? So aftercare Z codes, they do not usually stand alone. So they are often used along with other aftercare Z codes and diagnosis codes. So this gives the clear details about why the patient is in the aftercare phase. For example, aftercare after the heart surgery. So you have to assign aftercare Z code plus code showing the type of surgery. And the sequencing, it always depends upon the situation. So when more than one aftercare code is used, the order depends upon the main reason for visit and what care is most important. So there is no fixed order. You have to use a clinical judgment. So some aftercare codes need a secondary diagnosis code. So certain aftercare Z code categories do not tell which condition is healing. So you must add a secondary diagnosis code showing resolving condition or sequela, that is a late effect. So other aftercare codes already include the condition in the code title. So there is no extra diagnosis code is needed. So next is additional aftercare terms in Z codes. So some aftercare Z codes, they include terms like fitting and adjustment. That is, for example, processes and devices. And attention to artificial openings, tracheostomy, colostomy, ileostomy. So these codes focus on care and maintenance, but not the disease. Using status Z codes with aftercare codes. So status Z codes, they describe the long-term conditions after the surgery. So they can be used with aftercare Z codes to explain what surgery was done and why aftercare is needed. For example, Z48.812, it is surgical aftercare following circulatory system surgery, and Z95.1, which is the presence of aorta coronary bypass graft. So together they show the patient is in the aftercare phase as well as after the heart bypass surgery. So when not to use a status code. So do not add a status code if the aftercare code already explains the status. Example Z43.0. So encounter for attention to tracheostomy. So do not add Z93.0 for tracheostomy status. So because Z43.0 already tells us the patient has a tracheostomy. And here are the categories of aftercare Z codes. So aftercare Z codes, they are used when a patient is coming back after the main treatment is already done. So these visits are not for treating a disease but for healing, recovery, follow-up care and device adjustment. So what is the important rule over here? Do not code the original condition, that is fracture, disease, injury again. So instead you have to use the appropriate aftercare Z code. Z42, encounter for plastic and reconstructive surgery following medical procedure or healed injury. So this is used when the patient is seen after a plastic or reconstructive surgery. Examples like follow-up visit after a burn reconstruction and post-operative care after a cleft lip repair. So the injury or condition is already healed or healing in this case. Next is Z43, encounter for attention to artificial openings. So this is used when care is given to surgically created openings. So artificial openings include colostomy, ileostomy, tracheostomy and urostomy. So what are the examples? Cleaning and care of a tracheostomy and changing a colostomy bag. So next is Z44, encounter for fitting and adjustment of the external prosthetic device. So these are used for external devices outside the body. Example, artificial limb, arm or leg, external breast prosthesis, external hearing aid. So this is used when fitting, adjusting or checking the device. And next is Z45, encounter for adjustment and management of the implanted device. So this is used for devices implanted inside the body. For example, pacemaker adjustment, cochlear implant check and implanted infusion pump management. The device is already placed. So visit is only for the adjustment or monitoring. And next is Z46 category, encounter for fitting and adjustment of the other devices. So this is used for medical devices which are not other than the prosthetics or implants. Example like an adjustment of urinary catheter, adjustment of contact lenses and brace or orthopedic support adjustment. And Z47 is about orthopedic aftercare. So this is used after bone, joint or muscle surgery or injury. For example, follow-up after the fracture surgery, removal of the cast and physical therapy after a joint replacement. So do not code the fracture again. And next is Z48 category, encounter for other post-procedural aftercare. So this is used for general aftercare when there is no specific category fits. For example, suture removal, post-operative wound check, dressing change after the surgery. So this is very commonly used after the surgeries. And Z49, encounter for care involving the renal dialysis. So this is used for the patients receiving the dialysis treatment. Example like hemodialysis sessions and peritoneal dialysis care. So this code shows the patient depends upon the dialysis. And next is Z51. So Z51 is for encounter for other aftercare and medical care. So this is used for other types of aftercare which is not listed above. For example, like chemotherapy sessions, radiation therapy, palliative care, and this is often used for ongoing medical treatment rather than recovery only. So this is about today's session. I hope the session has helped you. So the next session, we'll be learning about the follow-up care Z codes. Thank you.